So today I'm back talking about the vaccine. It's been months and we have 3 different vaccines approved here in the US. Of course, they're all FDA emergency or youth authorizations, but that's the way it has to be. And I actually got one of the vaccines myself, and I'm here talking about the US. How the US is being stupid after having been stupid. So just because you were stupid in the past doesn't mean you have to continue being stupid in the near and present future. So the US has handled the pandemic worse than any other country in the world. If you just look at death rates and look at how much resources countries have, well, US seems to have a little bit of resources, I would say, compared to Brazil, for example, or South Africa, or anywhere else in the world. And just because they were stupid, for example, remember when the government said, don't wear masks? Yeah, So the only way of handling this pandemic is the vaccination campaign, which the US has been doing a pretty good job of rolling it out, surprisingly. And now they're saying, just like Europe and the vaccine and the blood clot issue, oh, let's have a pause on the Johnson & Johnson vaccine. First of all, we know that people are horribly non-compliant here in America. They don't listen to any rules. Social distancing? What social distancing? There's nobody enforcing social distancing. Masking, well, some stores manage to do it to a better job than others, but basically, what are you going to do? You approach a guy, tell him to wear a mask, get shot? Yeah, that's a good trade-off. So the only chance the U.S. has of controlling this, of getting back to quote-unquote normal life without having masses and masses of people dying, is the vaccine. And there's 3, and the one we're talking about today is the Johnson & Johnson one. So all the headlines today are announcing the CDC recommending a pause. There's a rare risk of blood clots, but actually the New York Post, which is one of those tabloid newspapers that's just sensationalizing it, actually puts this best. 6 women out of 7 million vaccinated develop these clots. Let me think about that risk here. So that's less than 1 in a million. I won't bother to list how many zeros after decimal point that is. Actually, let me list it for you. It's 0.00000001. It's pretty low. It's about 6 times less probable than winning the Super Lotto jackpot, which I'm sure nobody ever thinks that they're going to win, and getting $36 million. So the U.S. has made many mistakes with this COVID. And I think they've made many mistakes with the vaccination as well. But should they continue making mistakes? They're telling people the vaccination is 100% successful. Remember in the past when they're saying 50, 60, 70 would be wonderful, and now they're saying 100% we hit that magical thing? Well, first of all, let me tell you, in the medical field, there's no such thing as 100%. You could have the simplest case of a pneumonia, and I can't guarantee 100% you will get better, because there is no 100%. It doesn't work that way in science. 99.9% isn't 100%. That's actually the tech companies. They know what 100% means. 100% reliability, that means your system never goes down. They'll give you 9s. You'll pay more for more 9s to ensure your cloud never goes down. But there's no 100%. You just can't guarantee that. So we know some data, actually. Washington State tracked COVID cases after vaccination. 12 got sick. They had symptoms. It wasn't just their PCR was positive. 8 were hospitalized, all over the age of 80. They're pretty ill. 8 out of 4 million, that's pretty low. Your risk of hospitalization, 99.999998. That's near 100%, but that's definitely not 100%. And the problem is the expectation. So the government tells people, expect everything and don't worry, there is no risk. And that's simply not true. And I see many doctors doing this thing as well. I would like to call it inexperienced, but some of them have been practicing for decades. So they say there is no risk to this treatment. They tell the patient, don't worry about it. And that's simply a lie. You don't do this to people. There is risk to everything. There's risk crossing the street. When I explain that to people, they understand, because every now and then you read in the news how this guy crossed the street and gets hit. The Marine survives his stint in Afghanistan, blah, 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 and he comes home and he dies. It happens, right? And this is how you get sued. At least this is what I learned. So you tell a patient there's no risk and something bad happens. Well, guess what? You lied. Plain and simple. Because things do happen. Even simple things have risk. So I remember in pharmacy school, my cousin was there. She was telling me about how a student, they were practicing giving vaccinations on people. They actually weren't giving anything, just like, saline. So they injected people, and then someone developed a hematoma. That means somehow you hit a big enough blood vessel that it bled, and you have a swelling here and a lot of blood. Isn't that ridiculous? Well, because there's risk to getting vaccines. There's risk to doing everything. So we know this. At least certain fields in the medical field know this. There's upside, downsides. There's this risk, but the benefit outweighs the risk. And so my friend who's an oncologist often has this discussion with the patient because nobody comes in thinking, oh, chemotherapy, yeah, that's easy. Who thinks that? What surgeon talks to the patient? Oh, don't worry, this is a simple surgery. Nothing's going to happen. Really? I'm sure this surgeon, if they've been practicing more than a few years, realizes things happen when you least expect it. A lot of patients die during routine surgery. And guess what? If the doctor told them nothing was going to happen, pretty sure that doctor's going to get sued for a whole lot. But for medications, for vaccinations, often we don't have this discussion. But I do if patients ask me, is there a risk? And I just tell them, yes, there is. There's a risk to this. There's a risk to everything. But the benefit outweighs the risk. And this is what I'm recommending. So why is the CDC recommending pausing the Johnson & Johnson vaccine rollout? It makes sense to me that this is something that could be related to vaccine. Europe has already struggled this with the AstraZeneca one, the Oxford one. They have the same vector in a sense, the adenovirus vector. So it makes sense that there is a risk, but it's not about the risk, it's about the benefit. We're probably undergoing a second surge here, or third, or fourth, I don't even know how to count. And we're saying that, hey, our weapon, yeah, there's a 1 in a few million chance it will develop some consequences. So let me just ask you to hold off using any weapons while the enemy is coming on. Thank you for your cooperation. The Johnson & Johnson is a game changer, not just because it's the third one, increases supply, but because the supply has increased doubly. The Pfizer Moderna ones require you to come back in 3 weeks versus a month. This one, you're one and done. How many people got the first shot of the Moderna one or Pfizer one, got scared away by the side effects and came back? This one seems to have less side effects in terms of just what you feel. It may have this real risk that's very low, less than a 1 in a million chance for some clots. But is that meaningful enough to pause this thing? What is the time to doing additional research going to help with? It just mixes the message. The government's saying these things are safe and now saying not safe. Actually, we did more research and say it's safe. This is what the government's been doing this whole time. They already lost the public confidence by sending mixed messages. Telling people not to mask when they should have. Telling people to get the vaccines and now saying, wait. The only silver lining in this cloud do I see is that maybe the states won't listen to the federal government, to the CDC, which is what they've sort of been doing all along. Don't listen to them. Keep on giving the Johnson & Johnson vaccine. It's a vaccine that is somewhat effective, which is all we want. It's a vaccine that has some risk, which is always what we should have been told. And if you think the benefit of vaccine outweighs the risk, then go ahead. Get it. I did.